everyone, I am Dr. Ravina, NHS doctor, specialised in women's health, and I'd like to welcome you to this dedicated channel for women's health. Today I have got a really special guest, and he is actually one of my best friends from medical school. So we trained together, we became doctors together, and I'd like to introduce you to Dr. Nimrath again.
Hello.
He is a ophthalmology doctor early in his training, and so ophthalmology is the specialty that focuses on the eyes. So today we'll be giving you loads of amazing tips to help you protect your eyes and make sure you have the best health you can when it comes to eyes. So I'm going to hand it over to Nimrath, and a lot of you have asked a few questions surrounding things like contact lenses, how to deal with dry eyes, and I think especially during COVID, a lot of us are looking at screens lots. We are sitting at home, we are watching things on Netflix loads. I know that I am definitely, and we're just literally having screen time all the time. And so we'll have a little bit of a conversation about the effects that's having on our eyes and how we can protect our eyes. So let's dive straight in. Question number 1. So Nim, in your training and in some of the experiences that you've had, what advice can you give to us on how we can protect our eyes if we wear contact lenses? I am definitely someone who wears contact lenses almost every day, so I personally need this information.
So contact lens use is very common. It's something that a lot of the people out there are wearing. It's becoming more and more common, and it's very important to know how to maintain very good contact lens hygiene. And the main reason for this is because I've seen a lot of cases where people who use contact lenses every day come in with an acutely sore, red, painful eye, and they've developed, bacterial infections on the front of their eye and ulcers on the front of their eye. And in some cases, these can be really serious and can lead to sight-threatening infections of the eyes.
Okay.
So there's 3 things that I would probably say to all patients who I usually see who wear contact lenses. Firstly, make sure you're not wearing your contact lenses when you're swimming or when you're showering. And the main reason for this is because there's some infections that you can get in water that can be particularly nasty, and it's very important to avoid these. Secondly, I would say try not to sleep in your contact lenses.
Okay. Yeah.
Again, I know a lot of people are guilty of this, and it can actually be something again that may just precipitate or exacerbate your chances of getting an infection on the front of the eye.
Yeah.
And thirdly, try not to use your contact lenses past their use-by date. So if you're wearing dailies, dispose of them after the day. If you're wearing weeklies or monthlies, don't go over their use-by date. And make sure you're seeing your optician regularly and having a talk about your prescription and also your contact lenses.
Yeah, that's actually really useful. I'll hold my hands up because I actually do a lot of those things, and it's really useful having a friend who is also an eye doctor, because he usually tells me off. So we're actually in a staycation. We're actually in a staycation at the moment with all of our medical school friends, and we were just chilling in the hot tub actually, and I had my contact lenses in, and Nimrath was like, "You are not allowed to do that," and he actually told me that I should take them out. So I hold my hands up because I'm guilty of this. But actually, what Nimrath sees is like the worst cases, and I can't even believe that you can actually get ulcers on your eye. I haven't seen them in my life, but I'm sure you have.
Yeah, they can be relatively common actually.
Yeah.
Usually they're quite small, and we can treat them really easily in most cases.
Yeah.
It's just a bit of discomfort for yourself, and and it's just something easy to avoid.
Exactly.
And it's only in, like you said, a few rare cases where you can get particularly nasty infections.
Yeah.
Again, we can usually treat them, but it's always best to try and minimize your risk.
Just avoid it. I mean, it's when it's your eyesight, like that's your actual vision.
Exactly.
When there's any risk of actually going blind from contact lenses, then just take them out. No, that is so true. So Nimrath's actually, so we started medical school at the same time, and Nimrath was one of those people that, you get those people that work really hard and have to study loads for exams. Nimrath wasn't one of those people. Nimrath was basically, the crammer. Like the day before the exam, he would be up all night doing an all-nighter, go to the exam, smash it out, get like the best grade, and he just sell through. So he has lots of amazing knowledge. So that leads on to question number 2. So with obviously like change in season, with lots of conditions in terms of like if you're in humid weather, if you're watching TV, some people deal with very dry eyes. And I when I have contact lenses in, I notice I have dry eyes. What tips can you give for people that have dry eyes?
So I think with dry eyes, it's a very common condition. And again, it can be exacerbated by other things as well. So don't look at just the eyes themselves, but the eyelids. And I would say, firstly, the most simple thing to do is you can buy simple lubrications from over-the-counter eye drops.
Just from like pharmacy?
Exactly.
Okay.
Sometimes it's best to go for preservative-free, especially if you tend to have kind of more allergic reactions to, anything really. If you kind of suffer from eczema, atopical diseases, which make you more prone to these allergic reactions, go for something a bit more preservative-free.
Yeah.
And you can't really overdo it with lubricating drops.
Yeah.
So just every now and then, you can pop one in, and it just helps to maintain that tear film at the front of your eye.
Okay.
The other thing which I think would really help is maintaining the hygiene around your eyelids. And there's a lot of different techniques that you can use to do this, but the main principles are using some heat and something just to clean the eyelids. So what I usually would tell my patients is you can boil some water, let it cool down a bit, and then soak a flannel in that water, and then just keep it on your eyes for about 5 to 10 minutes, and then gently wipe away any kind of crusting or grease on the eyelids.
Okay.
And what that helps to do is it just keeps your meibomian glands, they're the glands that sit in the eyelids and secrete oils which are necessary to help your tear film, and it just keeps those glands nice and open and prevents them from being blocked, and which can lead to other causes of a bit of inflammation and infection. But also just allows your tear film to really work and stay maintained properly, and just keeps your eye nicely lubricated from day to day.
Yeah, that's really important, because what I've seen, and you'll have so much more experience, is when you get dirt stuck in these important glands in your eyes, you can get inflammation of the eyes, you can lead to blepharitis, conjunctivitis, loads of different infections of the eye. And it can be painful, can't it? It can be quite irritant.
Yeah, so I mean, there's a condition called blepharitis where those glands get blocked. This is usually kind of more common in people who have eczema and dry skin, particularly around the eyelids. But it's relatively common and can be really frustrating. And even, I guess, if you're wearing a lot of makeup or applying a lot of products around the eyes as well, it might not necessarily cause blepharitis, but it's always a good idea to just try and really clean away that makeup and those particles, and just keep those eyelids and those glands really nice and clean, and allowing that tear film to be produced and maintained and healthy.
Yeah.
And that can go a long way to just keep your eyes a lot more comfortable and less irritated.
I think I can completely relate to that, because as women, we like to put makeup on, and I've done my eyeshadow today. So it's just, sometimes if you don't take off your makeup, there's always that risk that you're going to leave makeup in your eye that can obviously infect your glands and your ducts. So would you suggest using cotton buds or cotton pads or anything?
Just anything really. So cotton pads, cotton wool buds, and just kind of dipping it into hot water. I think previously there used to be advice to use a very gentle cleanser, something like baby shampoo, and you can mix that in with warm water, and then just kind of rubbing the margin of your lids and just giving it a really good clean. Ideally twice a day. But even if doing once a day thoroughly would be quite good, just for general maintenance of your eyelids.
That's a really good tip, and I think that's quite useful for women, because when we wear makeup, we always wonder, okay, what product should we use to get rid of our makeup? But actually, just using something really simple like baby shampoo not only gets rid of the makeup, but it's actually very cleansing and gets rid of all that bacteria.
Like I said, I think the baby shampoo is something probably more back in the day that we used to. Now I usually say just using water, even micellar water that you can get from your
there's loads
local
of brands.
pharmacy. I think that's actually very gentle on the skin as well.
Okay,
and that's something that shouldn't irritate your eyes as well.
That's really useful. Okay, question number 3. So in this COVID world that we're now in, many people are working from home. They're using screens a lot more. They're using their phone, their laptops, TV. Everywhere you look, everyone's pretty much using a screen.
Yeah.
Even when you're on the train, you'll just see everyone down looking at their phone. Now, what effect does this have on our eye health? Can we be straining our eyes from perhaps sitting too close to the TV, perhaps watching too many movies on Netflix, on our phone? What effect does screen time have on our eyes?
So I think the important thing with screen time, again, obviously working from home now, people are going to be using their laptops more often, and meetings on Zoom and everything. I think the important thing there is to know when you're reading and when you're watching something on the TV or reading something on the screen, you tend to blink a lot less. And again, that just really will dry up the front of your eye and can cause your eyes to become quite irritated and dry if you're doing that for long periods of time. There's a lot of myths that go around about sitting too close to the TV, or your eyes becoming inflamed if you're reading too much. I think these are all very, very much myths. You're not going to get any inflammation of your eye. What tends to happen is that if you're reading a lot or if you're watching screens a lot, your eyes are focusing, and that uses a lot of little muscles within the eyes. And that's what can give the effect of an eye strain. And may cause and precipitate headaches and things like that. So I think especially in this era where we're going to be using screens more often, I'd say the best thing is to try and just take a break every so often, and make sure you allow yourself to take regular short breaks, and just to really rest your eyes and give them a chance to do something different. And I think that'd probably be the biggest advice, I think, for working from home.
That's super useful, and I'm sure that relates to so many of us that are sitting at home. Perhaps you're working at home more rather than going into work, so that is really, really good advice. Okay, so last question is something that actually relates to me quite a lot, and actually I think all of these questions have been very relatable. But this is to do with using screens before you go to bed. And I know there's a lot of research that shows that using your screen in bed before you go to bed actually stops you from going to bed. So what's your opinion on this? What tips can you give us in terms of screen time and the effect it has on our brain and on our eyes? And another thing is, a lot of you might have actually seen this on the internet, is the use of glasses. So I think it's
the blue light
glasses, and what effect does that have? Do they even work? Can you just tell us a little bit about the effect of screen time on our eyes?
So I think you're right, we're all guilty of this, myself included. I think it's very important, you're right, there is a lot of research out there to support that the light that comes from a lot of our screens and from our phones can alter certain chemical pathways in our brains. These chemical pathways are involved in going to sleep. So these pathways can be interrupted by these blue light, and you get a lot of these kind of gadgets that are coming out now, blue light glasses and filters that you can put onto your screen to take away the blue light. And I think while theoretically they might work, I don't think there's actually any strong evidence out there right now to say that these definitely work. You can try them and see if it works for you, but I think the best advice that I would recommend is giving yourself a break from your phone, especially before you're about to go to bed, maybe an hour or two before you sleep. Just telling yourself you're going to put your phone away, you'll pick it back up tomorrow. And it just gives yourself and your brain that chance to get in a mode ready to sleep. 100%,
I completely agree with you. And I think there's so much literature to show that the effect of screen time on not only your mental health, but also your physical health. So that is so relatable. Thank you so much, Nimrath. That information is so useful and so relatable to all of us who wear makeup and contact lenses and perhaps don't wash our face properly. So thank you so much. If any of you have any comments, then please drop them in the comments below. If you have any questions, let us know. I think that's our friends outside waiting for us to finish, because they are actually organising a murder mystery for us. So we better go get ready for that. Get into character. So I think that comes to the end. Let us know if there's any questions. Of course, as normal, please send any questions you have to my Instagram at dr.ravina. If you'd like to download your free ebook, you can click on the link down below. I'll get Nimrath to jump in the comments for any questions that you have, and we might have to get you on for a part 2 because he's full of loads of information.
Anytime.
So until next time, take care. Bye.